Assalamu alaikum warahmatullahi wabarakatuh. My name is Dr. Sayyid Zishan Javed Hashmi. I am basically from Pakistan. I have done graduation way back in 2004 from Pakistan, and I loved anesthesia. So I did my training from Pakistan in anesthesia. I did FCPS, and in the meantime, when I finished my training, I came to Saudi Arabia. And since then, I am in Saudi Arabia. I did some international exams as well. And it is just my luck that Allah has blessed me a lot. And I became a consultant in 2019. And right now, I am working in a military hospital in Riyadh. Okay. So when I was stuck in my exam, I suffered a lot, and that gave me an impulse that when I pass the exam, I have to be in touch with the studies, and I have to help my juniors, my fellows who are still in the that phase. And it started with a very small group of people who were preparing with me, and then gradually we added on, and then after some time, when I
Yeah,
appeared in international exams, I got more confidence and I started teaching uh, via Zoom. And then since then, I'm teaching. And then around 2 years ago, I put medical students on board with me. So I have another forum, which is today I'm talking with on behalf of that platform, which is Blooming Flower, and our aim is to make nipping birds blooming flower. Okay, so again, uh, because the people who are already doing something, but still they have margin for improvement. Okay, and that's what I say, that whatever, even like today, wherever you are working, maybe you can look for something better. Okay, so what you can say, the day of your life, when you wake up in the morning and you sleep without learning anything or without teaching anything, that day of your life we have lost. Okay, so this is the basic message which I want you to give. This is one thing. And another thing I will tell you, that if you want that you don't forget what you have learned, start teaching whatever you know, please start teaching to anyone around you. You will not forget that thing. Okay, so this is the basic message. Because what happens that, sometimes some people who became static in their life, they don't learn, they don't read, they are not studying anything. So what happens, they become rusty, and that gradually someone becomes better than them, and then they lose their importance, and gradually they are behind part. Like, give one example for it. Many years ago, the use of ultrasound came. Okay, and then ultrasound, I remember myself, even then in 2012, when I was working in the National Guards hospital, majority of guys, they used to take arterial line or central line blind technique, and they used to make fun. Oh, we can do it with the manual, why we should use ultrasound? Okay, now it has become nice guideline, National Institute of Clinical Excellence. And they say that if you are doing a CVP and you don't use ultrasound and there is some complication, you are not covered medical legally. So this is just giving example. Similarly, for surgical perspective, there were people who used to do open surgery. Okay. And now almost majority of the procedures, they are being done laparoscopic, or there is a concept of minimum invasive surgery. So if, for example, they don't learn these things, they are out of date. So that is the motto, that don't think that if you are confined to something, uh, just close your door of learning. Okay? So if you do like that, you will never be able to move forward. Okay. So first of all, because our main, my, you can say, chief of guest and my main listeners, I would be like expecting their medical students. So I will say a few words about them, and then we will expand our discussion for career progression, what to do, what is the best pathway. I will try to cover in next one to 1.5 hour everything which you want to ask. Okay, so that's one thing. So, studies, if you are in first year MBBS, or you are in second year MBBS, or similarly, if anyone is preparing for any exam, remember one thing, there is a terminology what is called as integrated medicine. So please remember one thing. Now the fresh medical students who are studying a number of places, they are studying in modular system. So what is the modular system? That they, if they are studying CVS, so they are being taught for all physiology, pharmacology, pathophysiology, okay, of that system. So that's called as modular system. Unfortunately, still it's not there in every part of world, or even not all the medical colleges. But majority of the junior, they are aware of this thing. But even if you are not studying in that medical school where there is integrated medicine, please, I will request you, if you are in third year now and you came to know that you should be studying in integrated way, please, if you are studying pharmacology, go back to your physiology, go back to your anatomy, and try to fill in the gap. Okay. So whatever year you are, now you are final year, for example, I would request you, if you are reading CVS, go enter in the cardiovascular system physiology, like enter in the myocyte, or enter into the conducting system, how the conducting system is working, how action potential is generated. So what will happen, that if you are, even if you want to understand cardiac failure, or you want to understand what is angina, what is heart failure, you will be able to understand in a better way if you just revise. Okay. So this is the concept of integrated medicine. Please, please, please don't forget this thing. This is the most important thing. And if you are happen to listen to my words when you are in first year MBBS, please don't miss this thing. Study in an integrated way, and every day try to revise. Every day try to revise. Every day try to revise. Okay. And this will give you a big boost when, as you will grow in your career. Okay. And the same thing what you can do for the people who are appearing in the postgraduate exam, for example, even then this chemistry, this way is valid for them as well. How? I know that the people who are appearing in FCPS Part 1, or even USMLE Step 1, okay, they are, because they are given a mind, fixed mind that they have to follow, and they don't think out of box. Okay, like people who are appearing in FCPS Part 1, they are giving terrible, static, half cut, I would say very bad words about the books which you people are trying to read, and that does not give you any concept. Okay, so even for you people, please integrate again the same concept. If you want to understand about thyroid, you should be studying from the basic, how the thyroid gland is formed, how the thyroid hormone is being synthesized, how, what is the role of hypothalamus, what is the role of pituitary. Only then you will be understanding the system. And then if you are happening to read the those that so called previous pool, you will be able to understand. This is one point for them. Another point for them is that, please, 4 years you are studying the basic sciences. Okay, and now people are trying to pass this exam in 4 weeks. Is it a joke? Is it your uncle's home that you want to open the door and enter and hug your uncle? No, it's not like that. Okay. So please, please give respect to preparation of FCPS Part 1. And even if you want to read that bloody nonsense pool, please read them in a sense, because nobody has a clear cut stem. Nobody has got the clear cut answers. They are just trying to cram the words. So that will never work. And they are only running towards the queen. Where is the queen? And the queen is the answer. And this is not the way. What you should do from that pool, how you can use them nicely, extract what is being asked. That will give you a best way how you should be preparing. And believe me, if you want to prepare for FCPS Part 1, you should spend at least 6 months to 12 months. You cannot like prepare like USMLE Step 1. Okay. And I would use the word, I have never seen a rabbit going to an eye specialist. Do you know why? Because rabbit eat a lot of carrot, and carrot has vitamin A, and vitamin A is good for eyes. That's why you will never see a rabbit going to an eye specialist. So now change it. I have never seen a person preparing for USMLE Step 1 failing in FCPS Part 1. Okay. I have never seen a person preparing for USMLE Step 1 failing in FCPS Part 1. Majority, like more than 95% people will never fail. Okay. So the message is that whenever you are preparing yourself, prepare in a proper way. And the first slap should be the hard one. If you are thinking that I will just give an attempt, if you are only attempt, so attempt is useless. If you are just trying to have a feel of the exam, just even if you pass, that will not give you any advantage. Okay, so this word, so again repeat what I want to tell you, that studies are not a joke, and there is no free cup of tea. If you are thinking that you will wake up in the morning and something will be there for you, there it will not happen. No glory will touch your feet without hard work. You will have to do hard work. Yes, luck will help you, but it's not like that you don't study, you don't work hard, and you are thinking that you will get everything. There is, believe me, there is no free cup of tea. There is no free cup of tea. And without, if you are trying to just a shortcut, there is no shortcut to glory. You will have to spend time, you will have to work hard if you want to succeed. Okay, so this is another important point. So if you are a medical student, plan your career. If you, whatever pathway you want to take, I will tell you what you should do. Whatever, even whatever pathway you want to choose, remember one thing: don't lose your pathway for the basic country from you are, where you are. Okay, so majority people are from Pakistan, but there are some people from other country who are listening to me. So my request will be, even if you are planning for USMLE, don't bypass the exam of your country. So even if you are preparing for USMLE step 1, or you are doing FLAB, or you are doing Australian Medical Council exam, you want to go to Ireland, you want to go to New Zealand, you want to go to Gulf, wherever you want to go, please make sure that you have some ground. Okay, one in hand is better than two in bush. Even there are so many hurdles which can have, anything can occur. So prepare yourself, be ready. Even the people who are doing the graduation from outside, at least either way, that they, if they, you are able to do directly, you go to other country. But again, you should make your ways open to work in your country. Like the people who are preparing for step 1, they should definitely appear in FCPS part 1, and they should start training as the earliest possible time, and they can keep the other things side by side. Okay, at least pass it. Okay, no, don't do that, start the training, but at least you should plan for it and you should do it. So now the words for the medical students, please, from day one, prepare yourself for a career. You should be listening. You are, when the day you enter in the medical school, you are a doctor. You should plan your life, and you will be surprised the people who will be doing house job. I have seen people, like one of person, when I was a medical student, he was doing FCPS training, and believe me, he passed exam maybe in 10 or 12 years. And I think I was doing training of my FCPS, I was midway, then he passed the exam. So actually there is no concept of some the senior, it's senior colleague, they are colleague, senior or junior colleague. Don't worship them as if they are the final word. Use your own brain. All the medical students who reach the medical college, they are the cream of their college. They are the cream of their city. But what happens now, when they are entering in the medical school, they switch off their brains. They put it in the locker, they lock it, and they throw the keys in the dustbin. And they are not opening their own brain. They are just following others blindly without their own intelligence. And that's the first step towards their disaster. Use your own brain, my dear. Your brain is better than anyone else. Use your own intelligence. Whatever even I'm saying, don't follow me if my words are without logic. Yes, if I have logic, reconfirm my logic and then do it. Otherwise, don't follow anyone blindly. This is the most important thing which you should do. Okay, so whatever career plan you want to do it, plan it. Yes, now few words about what you should do. There was a question that what should a fresh graduate should do. Okay, so actually the thing is that now struggle has become too much all over the world. It's not like in anywhere you will go and you will get a red carpet. It's very difficult to enter in any system, whether you are in Pakistan, whether you are in India, whether you are in anywhere. And other countries, you have to analyze their opportunities by, first of all, looking at their population. How much is the population? Like everyone looking, sir, can I get a training in Saudi Arabia? Sir, can I get a training in Qatar? What, how, see the look at the population. Like Qatar, Saudi Arabia is relatively big, but look at Qatar. Qatar has minimum population. It finished before it starts. It's smaller than some of the countries, some of the cities of our country. What are you expecting that they will have limitless opportunities for you? Not at all. So the request number one for fresh juniors: don't even think to come to Gulf. Don't even. It will be a crime for you guys. Whatever economic situation is, this should be the last option, because first of all, you will not get a training. Even if you do their prometric exams and you do anything like that, maybe maximum you will get a job of a resident, and you will die as a resident. So that should be red flag. I'm putting so many crosses, because what why you are doing it? You are just want to run away from the system. You want to run away from struggle. You don't want to struggle. You don't want to work hard, and you are just trying. You will have some explanation. I don't have money. I cannot appear in the international exam, etc., etc., etc. But again, I tell you, invest your time, invest your energies. Don't try think that your investment will go. So if you are not able to leave Pakistan, or if you are not able to leave your country, please start doing training in your country. Okay, if you cannot get a training in your city, go to the other city, go to the other province, go to the other hospital, but start your training of FCPS. Okay, in Pakistan, if you are, or if you are in some other country, please don't waste your time. Start your FCPS training. Okay, people go for MCPS, people go for diplomas. Please, if you have a struggle or you have more competition, if you are doing something inferior, it will harm you. Like there are people who start, sir, we just get a chance, we had a seat, we went into MCPS. What will happen? You will cross your career. You will delay your success. If you will not do it, maybe 1 year you waste your time, invest your time, and tell your family that I cannot support at the moment. Unless, of course, there will be exceptions. There will be exceptions for the people who want to do MCPS. Number one, who have a very strong family background, or they want to live in a small city, they don't have any plan to go out. That is an exception. That is an exception, that you will settle in that specific city. Maybe you will have some chance. But if you want to keep yourself open, never ever try to do this MCPS or diplomas. There is whatsoever, no explanation will give you justification for it. Like, I will give you an example for my one of my mentor. Allah may give him highest rank in Jannah. His name was Sajid Usman Kaul. Way back in 2006, when there was no FCPS, not even FCPS was not there, not even you find DA or even MCPS, very few people. He has not registered himself as a supervisor for MCPS. Whosoever used to come to him, he used to ask him to do FCPS. Or I'm talking about anesthesia. Anesthesia, very few people used to go. Okay, so he used to discourage people from doing MCPS. So same thing I will tell you. If the competition is more, you cannot devalue yourself. If, for example, if no scope for even FCPS, what will you get by doing MCPS? So that's the thing, that at least keep your challenge up, keep yourself a little par with the others. So if you go for the diplomas in the early part of your career, please, this will be a disaster. MCPS and DA for the people who have not done anything in their career for 10-20 years. They have gone old, they have gone rusted. Okay, no, let's do MCPS. Diplomas and MCPS are for them. For fresh people, even people in Pakistan, unfortunately, they are doing MS, which is a politically based degree. Unfortunately, it is a university degree. It's supposed to be a superior one, but unfortunately, in our country, there is no replacement for CPSP qualification. Nobody in the world knows. Like, I never saw an MS of anesthesia. I think only one person I saw in Saudi Arabia in last 14 years. Okay, there are MS in some specialty, but MS again is the problem is that it's five. Can you believe this? That for anesthesia and majority of specialty, it's a 5 year qualification. It's a 4 year qualification usually, except for some uh, some uh, some specialized fields. This is not of value internationally, because people don't know about this thing. Yes, FCPS, some of them know about it, so maybe you will have some chance. Like in Saudi Arabia, if I tell, MS is maximum registrar. Okay, however, FCPS can become a consultant. There registrar, then there is senior registrar, and then there is consultant. Resident, registrar, senior registrar, and consultant. So MS, there is a problem. If you are forced to do MS, even then you should go for FCPS. Even if you are able to get training in FCPS in private institute, even if you are doing at low salary, do it. Because if you do it after 5 years, what will you get? If you are not able to settle, what's the advantage of wasting 5 years? There is a midway. The people, they have done, there is, this is a political discussion, but actually they have made an open way from MS to CPS, FCPS. You have to do 2 years training after your MS, so you can do FCPS as well. So even the people who are doing MS and listening to me, till the time they get any other opportunity out of the country or any other position, it's a wise decision to enter in the FCPS training, so that in between they can keep on trying on other things. But if they are able to do FCPS training of 2 years after your MS, this will not be a bad idea. Okay, this will not be a bad idea. So this is something. Then now comes another important thing, because people forget about this thing. Another important thing is that people are afraid from USMLE. I'm telling, for USMLE, for to start with, because this is the most organized, this is the most you can say advanced exam you can have for your medical knowledge. Okay, and the another advantage is that even if you are doing FCPS, okay, you finish your USMLE, you did not get a match, no problem. You finish your FCPS, and then you can enter in US by fellowship pathway. Okay, I will go in detail about it, but for instance, just trust this word, that there is a fellowship pathway which is there. If you do USMLE, finish your USMLE, you will be MD USA. Okay, you will be MD USA. You will have full of knowledge. You will be full of knowledge. FCPS will become easier for you. Okay, and then you will have opportunity open that, okay, you did your fellowship, you did your FCPS, and then there are similar pathway for fellowship, like if for you are have done in medicine. Okay, you have done medicine, and now you are working in a sub specialty. Okay, so you will apply for sub fellowship in that specialty. I will tell you how to do it. But first of all, you will finish your USMLE, you will become MD USA, you will do step 1, and then step 2, and then OET, and step 3. So you will become MD USA. So this will keep your options open any point of time. So now the people who have done FCPS and they want to leave Pakistan, they want to go abroad, USMLE is valid. Anyone, and like I am 45, even today I do USMLE, I can go to US. There is no matter, the age is not at all a problem. They are looking at your physical age, their mental and your working age, not the actual your age. Okay, maybe a 30-year person is dumb and a 50 years is much more active. Okay, so you can it's valid for life. It's valid for life. If you have finished and you have finished your registration, it's valid for life. There is no problem in it. Okay. I wish one of our colleague, he did fellowship from Pakistan, and he did one fellowship in US, because the options after fellowship, there is reverse residency. Okay, once you have got a repute in that hospital, there is always a chance that you enter in the residency system, in the residency program. So if someone gets a residency in US, I know that there are so many things about bad about US, but there is no place in the world better than US for medicine, for being a doctor. If you think about can be the best, you can say heaven for doctors in the world, it's US. So there is no match. And another thing, scientifically, I'm telling you, the training system of US is awesome. Okay, there is no training system which is near to US training system. I know that some people will not agree to me, but I have worked with US trained people, I have worked with British trained people. There is no comparison. They are much superior. Their training, their system, of course there are exceptions, but overall you will be surprised There is no exit exam in US. There is no mandatory exit exam in US. They are so much trusting on their training. And the one who has finished the training is board eligible. Okay. And it's not mandatory for them to do the exam. Yes, for something they can finish their board certification, but actually once they finish their training, they are board eligible. So this is again, because I have to cover a number of things, I'm confining myself here for a while, that anyone who is doing the graduation, if he or she, what you should be doing if you are in medical school right now, what I will suggest, because some people will say, sir, I will appear in step 1 in third year. This is a little optimistic. Okay, what they should do, have you heard of people doing preparing for marathon? So even for example, you and me, if anyone who's not is physically very fit, if he's asked to run for 100 meter, he will run. But if he is asked to run for marathon, nobody will even walk for 5 kilometers. So that's the concept of what I will suggest you, the same integrated medicine. Please study in integrated way, and you prepare for both steps together. Okay. And you some people say, sir, I don't have money. No problem. Is there any charges in studying? Will Donald Trump come to you and put a rifle on you that you are not appearing in USMLE? How come you are preparing for USMLE Step 1 books? So there is no harm. Even if you are a medical student, please, you should have Kaplan with you. Okay, you should have first aid with you, and keep studying. And whenever you possible, you can take the UWorld subscription, or there are leak material for UWorld which is available. You can keep on studying. You are studying physiology, pharmacology, anatomy, pathophysiology, medicine. Read from these books. It will be very easy. If you are studying from BD Chaurasia, or you are reading from Snell, or you are reading from Gray's Anatomy, no problem. You will like, you can say it is just like glorifying your studies, beautifying your study. You are like, you can say that you are going to the best beauty parlor of your city if you are doing studying your USMLE books together. Even this is a request to all my residents. If they are doing training in medicine, they are doing training in anesthesia, they are doing training in anywhere, USMLE knowledge will help them anywhere. So this, like, I'm maybe you are thinking I'm obsessed with medical USMLE. It's not like that. Believe me, I have 20 years experience in medical field. I have seen and I have worked really hard. Believe me, and what I have learned that if like Alhamdulillah, I have achieved a lot, but that's something which I regret, that I would have done. If I had done it much earlier in my career, it would be best thing. Okay, Arisha, I told you. I think you have joined just now. Don't even think about UAE or Saudi. Okay, at the moment, for freshly graduated people, if you don't do your training in US, every place of the world will be in your access, whether it is Saudi Arabia, it's UAE. Of course, there are limited opportunities because their doctors are their training system is much improved now. And believe me, after maybe few years, there will be no foreign doctors in Saudi Arabia. Maybe 5-10 years, maybe earlier than that. They are sending their doctors to Europe, sorry, to Canada, North America, and they are getting fellowships from there. And I am afraid there will be no chance for us. I will tell you which specialty. It also depends specialty to specialty. Okay. So this is what, let me refresh what I have told up till now: how to study integrated way, how to prepare yourself, how to plan your career, think about your future, think about where you are after 10 years. Don't look for immediate success. Even if you are getting something, but at the end of the day, you are losing, what's the advantage? Okay. So, like I did myself, I used to do private practice. I used to do 24 hours. I was busy. I did not study. I was stuck in my exam for 2 years, more than 2 years, actually, 2.5 years. And what happened? I became a specialist after late 2.5 years. So the salary which I lost in this part was not comparable to what I learned in that time during my training. So please focus on your studies, focus on your training, focus on your exams, because if you, even if you time, whatever requirements you have, whatever you want to, like for example, someone is recently married and now they are thinking, oh, I have a kid, I have to learn, earn this, and they are trying to save as well. They are trying to making a home, they are trying to buy a plot. This is useless, because at that time, if you are not investing your time in making yours worth more, what will be the advantage? Even if you build up a home, what is the advantage? Just tell me. At the cost of what? At the cost of your training, at the cost of your studies. Even if you build a home, this is useless, because the most expense you will face when your son, elder son, will go to professional college. Okay, at age of 19. So till the time your your elder child is growing to age of 19, you have time. Okay, because the real expenditure you will face at that time. Before that, whatever you are thinking, pamper and milk and dresses and jewelry, this is all nothing as compared to what you have. So the people who are struggling, please focus, focus. Think about your future in the long term, not for short term. Okay, so there are so many people who running for going to Saudi Arabia. Oh, I want to come to Saudi Arabia, I want to come to UAE. When I came to Saudi Arabia, again I will tell you few words about the specialities. What specialities which are needed 24/7? Okay, like ICU, anesthesia. Okay, somehow emergency, ER, maybe they have some opportunities still. Okay, but other specialities like medicine, cross, general surgery, big cross. Okay, then all subspecialties, because why, I will explain to you. Like medicine, for example, GI. Okay, cardiology, nephrology, rheumatology, infectious disease, family medicine. How many doctors they require? Very few doctors can run their hospital. Okay, so they don't need that much people. Like in, for if you compare with anesthesia, they, if they are 30 rooms, they need 30 consultants, because one consultant will be for one room, and some will be on call, some will be on administrative duties, so some will be doing like, so actually there are a lot of, because this is dedicated specialty, 24/7 services, so they need a lot of people. But if you are talking about GI or cardiology or nephrology, actually there are curtains. Majority consultants, they are locals. Gastroenterology, cardiology, interventional cardiology, nephrology, they majority, they are. General surgery is actually down and done and dusted, because general surgery is disintegrated now into, for example, breast endocrine is separate. Okay, hepatobiliary is separate. Okay, then this colorectal is separate. Okay, and you can say emergency trauma is separate. I'm not talking about the other specialty like urology or orthopedics and neuro, and these are separate. I'm talking about this one. So actually, general surgery as a specialty is finished. There is no scope for general
सर
surgeries.
वो
Or
वो सॉरी फॉर इंटरप्शन सर पीट्स का स्कोप क्या है
I will
आई
come
वांट
to
टू
it.
आस्क द स्कोप ऑफ पीट
I will come to it. So okay, so peds general pediatrics is finished, because same, you will be surprised. Peds endo, peds neuro, peds nephro, peds cardio. They have separated it. So general pediatric is finished. NICU is separate. PICU is separate. Then peds gastroenterology, peds neurology, peds nephrology separate, totally separate. Peds emergency. Okay. Unfortunately, now what are the problems in our country? We don't have such subspecialties. What they should do, they should immediately disintegrate our system in that way. Either they should start 1 year fellowships for or they should, after 2 years of training, they should let anyone do in some specialty so that have still have some chance. Unfortunately, this is not, because our people, our unfortunately our decision makers, they are sleeping. They are totally lost. They are like mafia in, like, which is there in every part of our country. Unfortunately, they are not thinking about you guys. They are only thinking about their positions. They are not interested. There is no training,
Uh,
unfortunately.
Sir, sorry for one more question.
Yes.
Which specialty related to PD super specialization is more recognized
It's not
in
matter
Gulf
of
countries
recognition.
or in USA?
Beta, I will explain to you. Listen, the thing is that generally I will tell you that it depends on various specialities, but I'm telling you struggle is there everywhere. That's what I was telling you, that specialities which needs 24/7 coverage, and they need a lot of people, and it's a tough specialty. Still in our hospital, even a lot of expatriates are here. But in other specialty, like for example, if you talk about interventional like for example cardiology, you will find some simple cardiologists who are just writing the medications. Okay, they are there. But if you are talking about interventional cardiology, okay, or electrophysiological study. This is all subspecialty of cardiology. Electrophysiological study, EP specialist. Okay. Then what else? Adult congenital heart. Then peds cardiology. Okay. There is fellowship in so many things. Maybe I'm not able to recall all of them. Peds cardiology, adult congenital heart disease. Then there is a specialty of like I am sorry. So actually, in these specialities, there is no expatriate. So forget about getting a job here in Saudi Arabia. Even if you are US trained, unfortunately, very few hospitals you will be able to get, because their own doctors are going and they are doing fellowships and they are coming back and they are working. Okay. So the struggle is there. So it depends on various specialty. Still, you will have to take a chance, choose whatever you write, whatever you like, and like then you can think. Orthopedic, again, orthopedic is divided. You name any specialty, I will tell you. Ortho, there is one pediatric ortho. Okay. There is one sports. Okay. Then there is trauma. Okay. And so 3 4 specialties are also there for orthopedics. They are peds ortho is doing only peds ortho. Sports injuries, they are only doing sports. And then arthroscopic surgeon who are doing only arthroplasties, arthroscopies. Okay. The scope, through the scope they are doing the surgeries. And then there are joint replacement, so who are doing the arthroplasties. So they it's totally disintegrated. Okay. So now what you should do, the question again they remain the same. What's in your hand? You should, whatever specialty you are taking on, again, if you are doing USMLE or you are doing even PLAB, for some words about PLAB, there is a big difference between the system of US and system of Ireland and UK. The thing is that in US, I told you that training is everything. Okay. In UK, the thing is that there are so many exams and people are so much attracted. MRCP, MRCEM, MRCOG, FRCR, okay, MRCS for our FRCA. Okay. These are all exams. They have nothing to do with training. Yes, it will be plus one. It will be just one edge for you. But what you need an English exam, you need a PLAB, or in Ireland, there is exam of press. Okay. And then you will be registered as a what you call as non-consultant hospital doctors, or you can say in our translated to our is simple GDMO, General Duty Medical Officer. It's not GDMO, but I'm just to make you explain. And then what will happen that on the basis of your CV, you will try to get a job. Unfortunately, there is no jobs now. Very difficult to get unless you have some experience. Like fresh graduates, you are again asking the same question, what fresh graduates should do. So fresh graduate, unfortunately, you have a lot of struggle. But the safer way will be that do you finish your graduation, try to finish your USMLE in between, because USMLE step 1 is equal to FCPS part 1 and step 2 is equal to PLAB. So step 2, PLAB, and some people also ask about AMC, Australian Medical Council. They are same, all clinical sciences. Okay. So you can prepare for all the exams, and whatever plan is open for you, you can track for it. And then you should, even if you are planning to do PLAB, okay, you want to try your luck. But how will you get a job? If you are thinking that you are finishing the graduation, you are just doing a paratha job, a light job, and you are doing PLAB. My very close, at least two cousins have done PLAB. They did not listen to me. They did not do a proper job, and etc. etc. And now they are struggling to get a job. They are not getting any job. There is no job. Like press is exempted for Pakistani doctors who have done 3 months training. So okay, so they are trying to go to Ireland. They get the registration, but there is no job. So how will you get a job? This is a $1 million question. So the only thing which is making you is that you start your training. You start your training, and the best place in Pakistan for training is uh, uh, no, 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 Jennifer, it's not like that. Let me ask if I have a permanent anosmia due to head injury. Uh, no, no. No problem, no problem at all. Where there is a will, there is a way. You can still do it. Okay. So Jennifer Rose is from Myanmar. She's my constant listener. Thanks a lot to her. Okay. Has no value in Gulf. Yes, Alicia. I will explain to you because this question has come. So let me explain to you. Actually, for UK Ireland, because I was going in detail about it. Actually, what you do after this thing, if you have got GMC registration or IMC registration, now you are registered as a doctor. Okay. Now, what's the next step? You will apply for jobs. If somehow you get a job, there is no guarantee that they are giving you a training. Training is something else, job is something else. Again, I repeat, training is something else, job is something else. Job, maybe you get a job of this non-consultant hospital doctor, or registrar, or SHO. Okay. But training, you have to struggle for it. That training, this MRCEM or these bloody exams have some significance. I'm sorry I'm using this word, but because I have done FCAI. I'm just to make you explain. Fellow College of Anesthetists Ireland. It is just like FRCA or FRCS of Ireland. I have done European Diploma in Anesthesia and ICU. I have done European Diploma in Regional Anesthesia. I have done a French University Diploma of Regional Anesthesia. But believe me, all of these exams are of no use. Yes, it gave me a lot of knowledge, a lot of confidence. I learned a lot. Alhamdulillah, it gave me a big benefit. But if you ask me, I am consultant only on the basis of FCPS in Saudi Arabia because they want training. These are all exams which are without any proper training. Okay. Some are eligibility based, some procedure based, like for EDRA or FDRA, I need to attend the courses over there, and then I appeared in the exam. Similarly, FCI, we are eligible for FCI final exam. So same is true for you guys. So without training, even if you have done anything, like for example, whatever, it is just like cherry on the cake. Cherry on the cake. Okay. So these exams are helpful if you have done a basic training. So basic training is something else. There is no replacement for training. So even if you want to do these exams, they will be only helpful if you get a training. So the problem is that if you have gone this through this exam, now you have to choose between MRCEM, for example, or MRCP versus lab to get the GMC. Because first step is to get the GMC. So PLAB is easier. These are it will be difficult. especially MRCP is hell of an exam. MRCP is very difficult exam. Okay, to be honest. So if you to be want to be cost, yes, if you are very good, you can. I'm not saying that you cannot pass, but it will be very difficult to pass. Yes, if for example, if you are doing a training, you have experience of 5 6 years, 5 years, 6 years, and then you have done MRCP, if you have done FCPS, then there will be chances of getting job in UK even, or Ireland. Okay, so that is the story, that if you have got more training, unfortunately directly running from Pakistan is not so easy. Okay, yes, USMLE is the most accurate. Why? If you apply, you get training, you will be in the heavens directly. You finish your residency, you are settled. There is no problem. Okay, so again I repeat, you, at least if you don't have finances, even if you don't have, because when the people think about US, oh sir, USML is very difficult. No, it's which is easy, just tell me. MRCP is easy, MRCM is easy, FCPS is easy, nothing is easy. Only one thing in the world is easy, that is the lap of your mother. If you think that anything is easier, you are wrong. Nothing is easy. Appear in FCPS, I can guarantee the people in the world, how come and appear in FCPS exam. Okay, I was able to pass this exam because I has a lot of trauma in my mind, and my I was, what you say, I was bamboozled by this exam. Okay, so there is nothing is easy, so don't look for easy. Easy is the, unfortunately this is our natural and national anthem. Some underhand, something easy. Sir, I used to think, I used to sleep, and I used to dream when I wake up, I will FCPS. No, please, no, it is not possible. Okay, so there is no free cup of tea. So I'm repeating the same thing. If you are trying, yes, there will be chances of going to to UK, but the thing is that you go step by step. Go, if you will straight away you will try to appear in MRCM, maybe it is difficult, maybe you pass it, I'm not saying this thing. Of course this will be superior to a plab, but you have to understand the risk versus benefit. Okay, which is easier exam, plab is easier exam. That's what I will again say. So, and yes, if you do plab, you get the GMC, you are doing the training. Later on, if you pass it, maybe you will have more chances to get in the training. That's the only advantage. And if somebody asks about value of these exams in Gulf, nothing. They need now, what is the next step in UK Ireland? UK Ireland, there are, to become consultant, there is two things. What is called as CCST, and one is Caesar. The people who have done FCPS, they can apply for equivalence. This is called as simple way. This is equivalence pathway, and this is training pathway. Okay, this is proper 7 years training. If someone has done FCPS, they can try for both things, and few of the years will be rebated. Okay, and in UK they can apply for equivalence. So equivalence pathway is relatively easier. Okay, but you can say this is Brahman and this is Shudra. This is superior than this is. If when they become, what will happen if they finish this CCST or Caesar, the college will send the papers to GMC that they have fulfilled all the requirements for becoming a consultant. So please change their status from journal category to specialty category. So they will become specialty doctor. Okay, specialty doctor or senior registrar, whatever. I'm just to explain, making you explain. Then they will become a consultant. But if they are applying, one person has CCST and one person has Caesar, Caesar will not be get priorities. CCST will get the priority. Okay. Of course, there are other factors will be there, but they will prefer CCST. Even Caesar, even if you have become a consultant by Caesar, UAE will not accept you. Saudi Arabia will not accept you. Not everywhere you will be accepted. Maybe some hospitals will consider, but not every hospital will consider. Okay, so CCST is the pathway. So to even if you have done MRCEM or not, your your job, your performance will define your further pathway. Okay, so only exam will not give a guarantee that you are getting a training position. You will have to fight for the training position. You will have to do research, audit. You have to give good references. Only then you will be able to get a training position. Okay. And in UK, by the way, the easiest way to become a consultant is GP. The easiest way to become a consultant in UK is GP. GP training is very easy to get, relatively easy to get, and 3 to 4 years, 3 years, I think, they become a consultant. So that's is still the best way. Even for example, for lady doctors who are doing in gynae, for example, actually I met some GP who is doing some outpatient day cases, some procedures of gynae ops as a GP. So that's another pathway, that if you have done FCPS gynae and you are not getting a training in gynae, maybe you can become a GP and you still will have some chances. So it's an easy job. So I think, and there is a scope. So still there is a scope. Okay, so that's all about UK, and same is true in Ireland. But the difference in that, in Ireland there is no training for non-Irish. You can only have this Caesar pathway. Okay, for Caesar pathway, as I told you, that you have to fulfill your requirement, but the jobs, the requirement, you will have to fulfill by yourself. Okay, if you have been accepted in training, they will make sure that they will make sure that you are fulfilling their requirement. Okay, so let's have a look on the questions and then I will go further. How to do house job, how to choose medicine, surgery, allied in house job. Actually, Saif, the thing is that the thing which you like, but usually I will suggest that whatever specialty you like, try to be like. For example, anesthesia is a specialty which will help you for any emergency procedures. So if you are in medicine, this will help you. Okay. Surgery, if you want to go in surgery, whatever surgical specialty you like, you can make it in allied. Okay. So it depends on what you like. I have done plab now. Jobs almost ask for membership exams. No junior level jobs in UK, unfortunately. Okay, fine. So that's what I'm telling you, that MRCEM or whatever exam you are telling, it will give you edge. Okay, but again, the thing is that if you are have done just MBBS, MRC passing MRCM will be a little difficult. I'm not saying you cannot do it. MRCM is relatively easier than MRCP, but because now it's a relatively newer exam, if I'm not wrong, there is an exam of MRCGP. There is so many exams. Okay, cosmetic dermatologist. So you will have to do training in dermatology. Okay, and then you will aesthetic is subspecialty of dermatology. Okay, in dermatology, I think there is oncology, dermatological oncology. There are so many subspecialties, so you will have to do training. Peds, neonatology, or cardiology. I wish to know any single international exam which can be used as exemption in any other country, when if someone couldn't get training from that specific country. Ishaq, I don't understand your question fully. There is no such exam. Okay, can you speak out, please? Ishaq, what was your question? I wish to know any single international exam which can be used as an exemption in other country. I don't think so. They need
So,
training. They need training.
मेरी आवाज आ रही है?
Yes, try to be speaking in English, Ishaq, because there are some people who
Okay,
don't
okay.
understand.
So,
Okay,
I'm just want to ask if I'm going to appear in USMLE,
okay,
and in any worst case, if I couldn't get any training there, so
okay.
is it possible get
FCPS.
exemption if I want
No,
to no I if I want to move to Australia or UK or Canada?
no, no.
Isn't
USMLE
an
is not a degree.
exemption?
USMLE is not a
Yeah,
degree.
it's
USMLE just
licensing
licensing
exam.
exam. Okay. Yes, I will
Yep.
tell you, many years ago, New Zealand, New Zealand used to give exemption for the people who have done USMLE. But I'm not sure about. Even I I I checked it out in 2014. So in 2014 it was there. Okay. Should I go for
Yeah,
anesthesia
because
retention if I?
currently
Yes.
New Zealand and Canada is offering students specifically if they have cleared PLAB or UK Royal College exam. That's why I was asking.
No, 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 not at all. Remove the word Canada. Okay, Canada, if any exemption for Canada, I would be there. In Canada,
Right.
my brother-in-law used to say that majority of the taxi drivers in Toronto are doctors or engineers. Okay, and I know at least two of my colleagues who one of them was gold medalist. Okay, but now unfortunately she has done FCPS and anesthesia, and unfortunately now she's
Oh,
working as in some subspecialty of paramedicals. She's working in echo or ultrasound or something like that. Similarly, there is another colleague who couldn't finish the FCPS, but she's now working as a RT. No, so Canada is not on.
right.
Canada is in entering. I don't know why they give immigration, but they are not letting us work as a doctor. It's not. It's near to impossible. It's near to impossible. Even if you have done USMLE, even then there is no guarantee you will be entering in Canada. Okay.
Right.
Yeah,
Uh,
can I
uh,
add here something, Dr. Zishan?
Sure, sure, sure.
Actually, what I know is they accept MRCGP with CCT from UK, and I know some
CCT.
people who are working there as family physician in Canada.
Yes. So
And
CCT is
basically,
something else.
yeah. So another thing, maybe I'm wrong, but to my knowledge, also USMLE they accept, and the students or IMGs then they are exempted from MCCQE Part 1. The people who are holding USMLE, and same is true for Australia as well. The students are exempted from AMC Part 1 who have USMLE with them. So basically, you guys, you need to check from their official website just to make sure whether is it true or not,
No,
rather
no.
just getting
Okay.
some information from
Dr.
the
Iram,
people.
I really appreciate your input, but I will explain to you. The thing is that even if they accept, what do you mean by accept? Accept doesn't mean job. Okay.
No, no, no,
The thing.
not job, exempted from part one, like
Yes, yes,
MCCQE
yes,
part
yes.
one or exemption from AMC.
No problem.
So if someone is not getting matched into America because of any reason, or they want
Yes.
to move to some other continent, so the option is there. Yes, they can, like this thing is exempted and then they can proceed. This is
Yes,
what
yes,
I'm
yes.
trying to. Yeah,
Yes, 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 you
yeah,
are absolutely right. But I will tell you something that actually, because step two preparation is even same to a EMC. Okay. So actually, that's not at all a problem. If someone wants to keep his or her options open, even if she needs to, he or she needs to appear in that's not a problem. So that the thing is that if you are prepared for USMLE steps, you can
yeah,
appear in any other exam at any time. So that's the
yeah, definitely, definitely. Yeah,
so
yeah. Just because if there is some change in circumstances, then yes, you can proceed with that as well. Thank you.
yes, no problem. Thanks a lot, Dr. Iram. So, what Dr. Iram is saying, absolutely right. She's absolutely right. There will be some exemption for some exams, but again, the struggle will be there for the job. The problem is that because Australia is a continent but has very little population. I know one of the doctor who recently got specialist pathway exemption, sorry, specialist pathway entry in Australia. There are so many people, but in anesthesia, I just recently heard one of the doctor. She's in process of registration, and she had to apply for the assessment, and then she had to appear in OET, and then she had to pay a lot of fees for the this assessments. Then she had interviews. She got a job after 1 or 2 years, and now she will be doing 1 year under supervision, and then she will have some pathway to settle in Australia. Same is true for if you have done training in UK, you have got CCT, then there are so many other options which will open for you. It's acceptable in Singapore. It's acceptable somehow in maybe Canada as well. Okay. Even from UK, people go to Australia because Australia is much after US. If some place is number two is Australia, the earning, the ease of life. But if you are UK, Ireland has no comparison to US. No comparison to US. Even Canada is very good if you somehow you are able to get a job. Okay, Dr. Iram, is it okay?
Sorry, Dr. Zishan, which point you are talking about?
No, I'm just what you were saying, that I just rephrased my words, and I just explained.
Yeah, with UK MRCGP with CCT, you can move to Australia. Currently, they have opened expedited pathway. So many people they are moving. Even I have seen people who have done MRCGP international, like
Yes,
they are not with CCT. Even they have accepted people, also those with expedited pathway, because there is quite shortage over there, and people have moved to Australia with MRCGP international as well.
but
So
they would
to
they
cut
would
short
need
for the
experience.
students,
Yes, Dr. Iram,
yeah,
for this.
definitely. So for MRCGP international, you need 3 to 5 years. You can check on their website. I think 3 years if you have properly worked, then you can appear in the exam. So these are the things which these guys should know, the new students, because these are the new horizons which are coming up. No doubt USA is a leader, USMLE is on top, but these
Yes.
are the other things which they should also know.
Thank you very much. Actually, you know why I'm stressing again and again USMLE? Because the USMLE preparation, if you prepare for USMLE, it is just like a marathon. Okay. So now you can appear in any exam very easily. Step one is equal to FCPS part one. Step two is equal to a lot of common things in PLAB and AMC. So if you, even if you prepare yourself and then your circumstances are pointing towards, like, females, they have to wedlock. So what will they do? If their husband is in Pakistan, they cannot leave her husband and saying bye bye, I'm going to US. So it's not possible practically. So you have to think about the other considerations as well. Yes, of course, their things can change at any point. There are so many lady doctors who are married to non-doctors in Saudi Arabia. Unfortunately, they are struggling. They are struggling big time because there is no jobs for them, unfortunately. Okay, so that's the thing. So another point which strike my mind, I have seen some people going to Germany. Okay, so for Germany again, the same thing is that you need to know the language, and language up to C2, I think, level, the expert level, C2 level they need, and then you can apply to their system. Not very I have don't have much information of how to enter in their system. Some of the doctors, one of them they contacted me, and he was doing the language. And of course, in Germany or any other this European countries, if you don't know the language, there is one doctor in our group, she is Romanian. So I think she is married to a Romanian, sorry, to Romanian, Pakistani Romanian. So she is settled there. So I know about her, she has done her training in Romania. Similarly, another doctor I know, she was in Norway. Same, her family was in Norway. So she graduated from Pakistan. She did FCPS from Pakistan, and did she, because she knew the language. So she had something, and then they asked her to do work in UK for some time. So she actually worked 1 or 2 years in UK, and then now they have accepted her as a consultant, so some specialty position in Norway. So there are so many pathways. Okay, but again, the thing is that the most it is possible to come to UAE after practicing in Germany. Listen, my dear, UAE is a very small market. UAE uh, is all believe me, like I would say that it is all like artificial. Okay, because majority of them are expatriates, and they have private hospitals. Not very, I don't think so there is any big government hospital. So private hospital, they are very miser in hiring people and in utilizing people. So if you are German citizen, if you have German training, if you have got the certificate of German specialty, yes, maybe you will have time. How much time should we give for AMC? This is a very subjective question. Anyone knows about himself or herself how much time you need to do. Okay, so let's, anyone wants to ask any question? I have explained a few of the things. The best pathway for you is that you study in an integrated way. You study in a way that you are open for any exam. You don't need to appear in the exam to prepare as a prerequisite for preparation. But unfortunately, because we say because we are only choosing USMLE pathway, so all other things are haram. If you are doing PLAB, you are not thinking about FCPS part 1. So actually that's creating a problem. So whatever you are, as Dr. Iram rightly pointed it out, there will be some opportunities after you did. But the thing is that CCT is the thing which you need to do. And all these exams like MRCEM or MRCGP or MRCS or MRCP, they are helpful only if you have training. Without training, they will not be of any help. Okay. Alone, they are nothing. Alone they are nothing without training. Unless you have done some proper training. Routine in-house job. If I pursue general surgery, yes, yes. Anesthesia will help you. Actually, the because I'm anesthetist and I used to say I love anesthesia every day more than yesterday. I love anesthesia every day more than yesterday. And actually, anesthesia has very little anesthesia. Anesthesia has everything other than anesthesia. And actually, the correct name, which is used in some part of world now, or it's perioperative medicine. Okay. And anesthetists are perioperative physician. So we should know each and everything. And I used to say that the care provided by anesthetist is like care provided by mother. Mother has to look for everything. Believe me, we have to work like an octopus. We have to look at everything, position. So the surgeon is doing surgery on a dead body. So his care is like a father. Father are little casual. Father are never like mother. They, if the father has to care, I am a father. I know how I will take care of my kids. I can never do the care of my kids. Yes, I will be safe, but my care will be very crude. My care will not as sophisticated, as meticulous, as generous like mother. Either I will laugh with them. If they are not listening to me, I will slap them early than my wife. So that's why I will say that mother care is like anesthesia care. So if you work in anesthesia, you will come to know that what anesthesia specialty is. I love anesthesia. I started in 2004 and it's 2025. And I say that I love anesthesia every day more than yesterday. And another, one specialty we did not have any word is radiology. The thing is that radiology now has the normal radiology has it only remain ultrasound, believe me. So it's the era of interventional radiology. Okay, interventional radiology. So there are interventional vascular procedures, interventional neuroradiology is another subspecialty. So they are doing every procedure, even tips, transjugular, intrahepatic portosystemic shunt. They are doing for cirrhosis patient. They are doing all the vascular procedures through like vascular surgery procedures, bypasses. They are doing. Okay. Then interventional neuroradiology. They are doing all the procedures for like cerebral aneurysm clipping. Okay. Scholarship for supraspecialization. Please, I will speak out for this thing. Scope of medical oncology in Pakistan. Medical oncology is a wonderful specialty, and it should have very good scope. Even very few people are there. I'm not sure about current status, but it's still it's a specialty where relatively less people are there. Okay, so you are asking about this super specialty scholarship. So actually, the problem is that for the people who are doing training, there is a so-called exchange program. First of all, I have an objection. That exchange program means some people are going there and some people are coming back. So how come it exchange? Who will be the crazy gentleman who will be coming from Ireland to Pakistan for training? So this is a wrong. And then a very secret thing I'm telling you, they are taking 200 euros per month, and it is making me embarrassed. Believe me, when I came to know, I was told by an Indian doctor. He told, your college is charging 200 euros per month. I was shocked. How can they do this? This is their so-called exchange program. And another thing, there is, yes, they get some advantage, but actually, if they can go there at their own, they are losing 2 years. If they are going in third year or fourth year, they will have to do 2 years more before they are appearing in the exam. Somebody told me that they can appear in the exam before. I'm not sure about it. I think they need to do 2 years training there. So this is not a worth thing. Then the super speciality, the thing is only that you have to come back. This is the thing. So what will be your utility? Whosoever go to Europe, 6 years package, and you will get their speciality somehow, and you will get the passport. This sense of insecurity for me, I am here in 14 years, and even if I live here up till my death, I will not get passport. Okay. And there is no certainty in your in Gulf countries. You can never get a passport. And actually, unfortunately, people belonging to our country, they should think about it. So if you happen to enter in UK or Ireland, the another advantage is that even if you are not getting training, if you are only working as a registrar, even then you will get a passport. Your kids will study in a very good environment. And yes, of course, there are so many problems being like being an ex patriot and belonging to a country of third world. You will have problems, and or really religious issues as well. But still, DA anesthesia is not acceptable in Gulf. Nothing, not at all, not at all. DA anesthesia is not at all acceptable. Okay, so you have to do FCPS on behalf of a friend. Best course of action, FCPS. There is no other replacement. You have to do FCPS. And rather, if I were a supervisor, I would send any young person less than 40 years of age coming for DA or MCPS. It should be a crime. It should be a crime. Okay. So any other question, please? Another question with reference to OET versus IELTS. For if you are only targeting Ireland, please no need for OET. Okay, because for Ireland, IELTS requirement is 6.5 each and 7 overall, which is easy. Then OET. Yes, OET for UK. Yes, and UK also for USA. Yes. So actually, they have removed the CS, because step 2 had two parts. One was CS and one was CK. So CK is clinical knowledge and CS is clinical skills. So clinical skills is replaced by OET now. There is no CS now. So OET is mandatory for USMLE. So if you are preparing for PLAB or you have any plan to do USMLE, OET should be there. But if you are only targeting Ireland, like people who have done FCPS anesthesia, they are going to Ireland and they don't need to do anything. They just have to do IELTS. A- And their exam, they will be helpful only, like someone told me, is it the scope of female general surgeon in Pakistan? Actually, I will give an example of my aunt. She is no more, but she was, some of the people in Lahore maybe know her. Her name was Professor Khalda Usmani. Okay. She is ex-principal Fatma Jinnah Medical College. She did FRCS way back. Maybe she died in 2015 at age of 70 plus, I think. So she you can say I'm giving you example of her. So she survived. So you can also survive. The thing is that you will have to be very tough because there will be a lot of problems you will face. To be honest, because our people are very cruel. Our society is very cruel. So you will have to become very hard. Okay. So it's not like you cannot do surgery. You can do surgery. There are so many, and I can tell you something. The female surgeons are very, very nice, very meticulous. If they are good, yes, they panic. That's another thing for anesthesia as well. Same is true for anesthesia. Same is true for general surgery. Sometime suddenly bleeding occur. If they panic, even I have seen female gynecologists getting panic. So that is actually personality problem. It can be for men as well, but if you are a female, that's just like they are very good driver and at the same time they are very bad driver. So if they panic, they are not a good driver. If they panic, anyone can panic, but the probability is more for female. So that's the reason. But if you are strong, if you have trust that you will not panic, no problem. You can do anything. Women can do anything. It's not at all a contraindication, who have already done MCPS in anesthesia and working now. They are 50. Should they try for USMLE now? Do old graduates get training post? Actually, the thing is that uh, I will keep this question as a question mark. Believe me, in US, I a few years ago, I found a person who was 50 plus and he was going for fellowship in US. Okay. But the thing is that, again, I tell you that you have to analyze yourself. Are you fit enough? Because they are not looking at your age. They are looking at your fitness, how fit you are. Are you working actively? That's the reason. Okay. Unfortunately, we are rusted. The problem is that I will tell you, believe me, talking to you, I have no interest whatsoever. But tell me one thing, as of my position, how many people are giving their time to their juniors? The worst thing about our system, our people, our college is making supervisors, and they don't know even the spelling of supervisor. They are only on professor. They want to be a professor, and they are doing it for private practice. This is a hard reality. Many people get offended at me, but that's a reality. They only become professor because they want to establish their private practice. This is a hard reality. They are not interested in becoming supervisor. They only are supervisor because of their position. And yes, what would you say in our language is the taka, the prestige, the rod in their neck. This is just for that. Do you know supervisor means they have to be on bedside? Okay. They have to teach you in OPD. They have to teach you in OR. They have to teach you in ICU. They have to teach you in bedside. If they are in the rounds, in the ward, if they are not teaching. Okay. And another thing, I ask this question to all my colleagues. When they get the signatures of their training paper, do they remember that Allah is looking at them? And this is a cheating if they have not done a training in proper way. The one who is signing and the one who is getting the signatures, both are criminal, both are doing a sin. And all of us like that, unfortunately, because very few, only institute in Pakistan which has training is Aga Khan. Only training institute which is following a proper training system is Aga Khan, AKU. They have a proper training system. So unfortunately, rest of us, like I pointed out, and then people became angry. There, FCPS anesthesia is a multi-dimensional specialty. Okay, so can you believe this? That training is going on in cardiac hospitals, in pediatric hospitals, in kidney hospitals. It's a joke. Okay, go to Children Hospital Lahore, go to PIC Lahore, NICVD Karachi, SIUT Karachi. They are doing FCPS training, and they say, "Oh, we send the people on rotations." Oh, come on, their cardiac rotation is 2 months only, so they should remain 2 months in that hospital and 46 months to other hospital. So why they are being hired in that hospital? Pediatric hospital. Unfortunately, she is a gem of a lady, but unfortunately, instead should have recognized that institute for pediatric anesthesia fellowship. Unfortunately, she is in the system, and the people are doing FCPS anesthesia in Children Hospital Lahore. Okay, and when I request, this is wrong. This should not happen like this. Nobody is listening. What can I do? What can we do? We are unfortunately stuck in this problem. Okay. Internal medicine after USMLE. In US, actually, majority people go in internal medicine. Okay. But after they do finish their residency, they will call as internist. Okay. But still, they can enter, like one of my class fellow, he did in internal medicine. He worked few years, he earned, and then he liked radiology. He tried for radiology and he did his residency in radiology. Okay. So in US, it's a land of opportunity. Pakistan population, if 250 million, US population is 350 million. Just imagine which place has more opportunities. And maybe, if I'm not wrong, 5 million population in Qatar. Okay, maybe 50 million population of Australia. What are you expecting? I'm not, maybe I'm wrong. Please correct me. So, bottom line of our discussion, first of all, I'm available 24/7. If anyone wants to ask any question, you are free to ask. Number one. Number two, I have conducted some such sessions before as well. Even so many people from various specialities spoke out. And I actually today I couldn't catch my one of my junior colleague who went to US, and now mashallah he's adorable. He's in such a great position. So that's why my bias is towards USMLE. But remember one thing, even if you do USMLE preparation, okay, that will help you a lot. Step one, FCPS part one, step two, PLAB, AMC. So you will have a lot of opportunities. Okay. And another thing, please don't run from hard work. Don't run from a good study, good concepts. Go do conceptual study, do topic wise study. Okay. This is now what are option we should consider as an IMG. What do you mean by options? Other than internal medicine, whatever you get. I know people who get, he was 5 years after graduation, he get a job in anesthesia. And anesthesia is one of the highest paid in US. After doing fellowship, reverse, nephrology is a wonderful specialty because there is a lot of demand in US. I don't know the reason. It's a tough specialty in US. Okay. And, but there is a lot of scope. There are so many people who did FCPS, went to nephrology, did one fellowship, and now they are working as a consultant in US. Okay. So remember one thing, hard work, planning your career, planning the things, don't go for shortcuts. Okay. And individual exam, these British exam, the problem is that without training, they are not of much worth. Gulf countries have no future for our system, unfortunately, unless you are trained in UK, Ireland, US, Australia. Unfortunately, there will be very little progression. Join here after FCPS. Actually, the thing is that FCPS is uh, SR, okay? But there are two categories: resident, then registrar, then senior registrar, and then consultant. Okay. In Ministry of Health, because I have described in detail, I can share to you about the hospitals, but I will quickly try to tell. Ministry of Health hospitals, they have only three categories: resident, registrar, and senior registrar is called as a specialist. Okay. And then the consultant. They don't have a category of senior registrar separately. So if you will get FCPS, after 5 years, you can apply for consultant. Like I did FCPS in 2014 and I became consultant in 2019 after 5 years of FCPS. Okay. But not necessarily that I get a job as a consultant. There are so many people in other specialities who have consultant card, but they are not consultant. They are working as a specialist. That's a problem. Okay. Because of the speciality, different speciality vary in opportunities and jobs. And like I told you, that very little opportunities for other specialties now. There is very little opportunities for other specialties now. Okay. Working here as a consultant. I'm sorry, what do you mean? Here after, if someone here like Pakistan, you are telling about Pakistan. If you are working as a consultant in Pakistan, after 5 years you are eligible for consultant. I don't understand your question, Dr. Zahid. I'm sorry, I don't understand your question. Can you speak out? Any one of you have any question? Please feel free. The people who are from other countries, like Jennifer Rose, if you want to go to US, you can do USMLE and you can try your luck. And then another thing will be that in between you should try to have internship. Okay, so that will be a precursor towards getting the fellowship program or residency program. So try to get some internship. Research, someone asked about research as well. Unfortunately, that's the most neglected part in our careers. Unfortunately, we don't have clear opportunity to do research, and that creates a big problem. Internationally, we have to do research, we have to do audits. Okay, so somehow, for that you need to learn first. In our group, this blooming flower, Dr. Afshan Khatak, she's from KPK, and she's a trained pediatric consultant in US. Okay, so she has a lot of input with reference to this one in research. So you can just drop a message to me and I can refer to her. Even if you are in Blooming Flowers platform, you can tag Dr. Afshan Khatak. You will find her in admins. If someone is working as a consultant career progression, you can do USMLE, you can go to US. Even believe me, if I were a little younger, I would be doing it. Maybe I'm not sure. This is, you can say, wish in my heart that I do USMLE and I go to US. I'm not sure whether I will be able to do it now, but I think we can do it because other places, unfortunately, like today, if I go to Ireland or UK, I have Irish Medical Council registration, and I've given them a wazifa of every year. I'm giving them around 3,000 reals. Unfortunately, this is every year I'm giving for the retention. Okay, I'm not 3,000 reals, something less. I don't remember the exact amount. Yes. So still, I'm not clear by your question, Dr. Zahid. If you can speak out so that I can answer. And before I finish, thank you, all of you, for joining. A special thanks to Dr. Iram, who gave some points. Yes, Dr. Zahid.
Hello, Assalamu alaikum.
Walaikum assalam. Yes.
Dr. Vishal, you are doing a really great job. I must appreciate your all the efforts. I am following
Thank
you
you.
for but long time. But what I was asking that after 5 years, if you join as a consultant in KSA, and ultimately they will hire Western qualification, and definitely they are not going to give you a PR card. What are the next options after KSA?
You should, even I tell you something that I have fear. I have this same fear which you are saying, and
Yes, exactly, exactly. And
the
same
best option.
ambition and same ambition. Do not
Yeah,
proceed with the USMLE.
yeah, we can do it. Believe me, that's what I'm telling you, that even I want to do it. Like I'm not sure
मिलके
how,
करते हैं
but
फिर. I am in
sorry,
Jeddah.
we can do
मिलके
it.
करते हैं steps. I am in Jeddah.
Yes. Where are you working?
I will. I am in King Fahd, Jeddah, as a consultant.
Okay, you can drop a message to me. Sure.
Okay, okay, sure. I will share my local number. We will be in contact.
Yes. So, anyways, actually, the US, the thing is that at any point of time, the opportunities are open for you. That's the big advantage. Okay. So, specialty pathway, comprehend. Thank you, Dr. Iram. By the way, can you introduce yourself, Dr. Iram? Where are you working right now? We will be very happy to hear from you.
Uh, Dr. Zishan, I'm based in UAE, and for a long time I have been here. Yeah,
You are which specialty you are?
OB-GYN.
MashaAllah. But you can say a few words about UAE because people are really interested to come to UAE. But I know the job opportunities and the options over there. Like in UAE, you can never become a consultant. There was only this special 10 years pathway. Did you try? Are you working as a consultant, Dr. Renam?
No, but actually there are a lot of changes here as well.
Okay.
Markets are saturated all over the world these days.
Yes.
You were saying right, UK, after the COVID, the situation has got very worse. People are not getting jobs at entry level, that is SHO. But okay, if they give exams like MRCP, then mid-level jobs, still with some effort, they can get entry. Yeah.
Yes.
But incoming, even now, the markets here in Gulf countries, these are very saturated. And you are right, upcoming, I would say 5 years or 10 years, there will be no place for Asian doctors on these side who are trained in their home countries. But yes, if you get international degrees like USMLE or UK with CCT, or are from training from Ireland along with their CCT, or from New Zealand or from Australia, then yeah, the doors are open for you. And yeah, this is the summary. So best route
Doctor,
still for
yes, Dr. Iram, one thing I will also get few words from you. There was a pathway which people are really interested, but I am 100% sure this EMRI. They people are very happy to that they will get a job there, but I don't think so. It will be for expatriate. This will be purely for their doctors. Am I right?
MRI, you
UAE
mean the postgraduate resident?
training, resident training in UAE.
Uh, just a couple of months ago, I met someone, but she was born and brought up here, that girl. She was not
Okay.
local expat, but she was born and brought up here. And she did all this Emory stuff and she did her residency here. Yeah.
Okay.
So I
So
know some
she have
people,
done medical also in UAE.
no, medical she did in her home country. Yeah.
Okay. Like it's a very rare
So
thing. And what about this, Dr. Iram? There's 10 years pathway. The people who are working as a specialist for 10 years, they have some
yes,
evaluation
they
and
can
then
become, yes, they can become consultant. Yeah.
yes. So otherwise, Pakistani FCPS is only specialist. Okay. So if someone
Yes.
is there for 10 years, they are eligible somehow with some evaluation or some exam, they can become consultant.
Yes,
But
then they are eligible for consultant. Yes.
so
But as I
it's a
told you, the markets here, they are becoming very competitive, and just like Saudi, they are also focusing more and more on board certified doctors, more,
mm,
and especially from America. And the people who have done CCT, they are more focusing on hiring these kind of people. Yeah,
okay, Dr.
and
Iram, can
sending
you
their
just
own doctors,
one more point, if you
sending.
can clarify difference between CCST and Caesar. Have you seen anyone who has done Caesar and getting a consultant position in UAE?
No, Caesar cannot become consultant here.
Okay.
Only CCT.
So
They
that's
don't accept Caesar as consultant.
yes.
Caesar
So
is
that's
take like if someone go to UK and he's working there, like you have planned to settle over there, then okay, Caesar is good for you. It's a career
yes.
progression for those people who did some initial training or FCPS from Pakistan or from their home country, and then they go and want to settle in UK. And okay, for career progression, Caesar is good for them. At least they reach consultant level. They are not resident or the entire life they are working as SHO or mid-level jobs. So it's good for those who, in the long run, they want to get settled over there in those countries. It's not bad, but if someone again want to come back to Middle East, which not all the people decide, I think so. So then you will not be taken as consultant with Caesar. Yeah.
Yes, Dr. Iram, just at this point, I would want to clarify one more thing because some people who were in Saudi Arabia went to UK, get the passport, but he did not do any training or even Caesar. Do you know what problem that gentleman facing now? Because in GMC,
What?
he is simple
Uh-huh.
doctor, general division. Okay, so there is no mention of
Okay.
anesthesia. Can you believe this? Even Saudi Commission is not accepting him as a consultant.
Ah.
So that's a big
So he is,
problem.
because they have two registers, one is GP register and one is specialist
Yes, one
register.
is
So he
general
kept on
division.
doing what I believe. Yeah.
Yes, so
So
he
he
have to
kept
be
on
in
working
specialty.
over there as like he did not work in anesthesia over
No, no,
there.
no. He's working in anesthesia since last 10 years, but he did not do CCT or
Mhm.
Caesar. Okay, so he's just working as a hospital doctor. He's earning. Okay, and he did not bother
But
about it.
but
And
he
now
has experience. He has
he has
experience
experience,
working as
but
an
general
aesthetist.
actually
Then why they are not
no, 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 no.
taking him
At
back
least I know
here?
two people. One of them, he's in anesthesia, and one of my class fellow is in orthopedics. Both of them has been refused
Okay.
because because they don't enter in general. They are general division. So they are asking because if you just recall our PMDC, they have written anesthesia, am I right? Our degree is written FCPS
Mm-hmm.
anesthesia. Okay,
Okay.
so
Okay.
in their GMC, it's not written. So they are asking, write anesthesia. They will not write. They will not write.
Mm-hmm.
So
Yeah,
that's
yeah,
a
yeah.
big problem. At
Yeah.
least two people I know. So that's another problem. So the people who are going there, they have to choose either of them. They will have to work because in Ireland there is no training. So there is only Caesar there. So that's another thing which
Mm-hmm.
anyone who is trying to go to Ireland. In UK, yes, CCT is there. So that's life is very complicated. So you will have to work really hard. Otherwise, you will remain on the back seat. Okay. So
The
any other
grass is
question?
not always green on the other side. So it's
Yes.
really you have to choose what you want in your life. Like,
Yes. Yes.
yeah.
Yes, so
Oh,
Dr. Sharadha Jiswani, you asked that you are 32 and you want to do USMLE. Believe me, it's the best age because you are mature, you have got some clinical experience. So that is the best time for you to do USMLE. Okay? You are not old. Yes, Dr. Zahid, you want to say something?
No, just I am enjoying your talk.
You are enjoying? Anyways, so thank you very much. And
Yes, I was just taking some conclusions that what our children should opt, medicine or not.
no, I will still, I have a strong emotional attachment with our specialty. Remember one thing, two things will remain in the world. One is medical facility and other is the money. So if any of your kid going
Well,
in
there was a
finance,
time, and still there is a time when I think that there is only one thing in the world, that is hammer and drill machine. There are two things you have to know how to do, because being an orthopedic surgeon, but really, after COVID and during my relocation in Pakistan and outside of Pakistan, what I understood that we doctor do not know what is business is, how to sell yourself, how to sell
yes,
something. और हम कहते हैं जी we say क्या we are doctors, हमें तो कुछ पता नहीं है हमने कैसे कुछ बेचना. We are selling yourself, आपकी qualifications, your experiences. I think basic concept should be indulged in our children and next generation. What is business is, and definitely risk halal is much more than a 9 by 10 parts is over there.
yes, you are absolutely right.
I
We
would
should
Anyways,
just
know. We
I
like
have,
should know
to
about the market. Know about the
yes, yeah,
international market. We should know the local market. We should know the, doctor महंगी, doctor सस्ता है. Doctor is earning. I just Ministry of Health is earning. Private setups are earning, but doctors are still poor.
yes.
I
Anyways,
fixed
yeah,
a fracture in Pakistan. I took 10,000 rupees, and patient come back to me that he told me that he have spent 200,000, because he calculated everything, each and everything, including medicines, including drapes, including implants, including other logistics, and doctors are still poor. We don't know how to sell, how to make a doctorate.
yes, you are right. Anyways, Dr. Aram, what you are saying?
I would just want to add, as you were saying, what should be the advice for our children? Actually, no profession is bad. Whichever profession you should go, it matters what is the passion that child has, whether it's engineering or medicine or IT or entrepreneurship, as Dr. Zahid mentioned. Wherever they want to go, let them do that thing, and that's just our brown parents' mentality, like just medicine or engineering,
Yes.
uh, just capture them in that thing. I think it's time has changed now. It's time now you go for computers or IT or AI.
AI,
It's
especially AI.
these are
Yes,
the
yes.
things which are evolving now. And okay, business is also like our prophet. He was involved in business and they used to do the business. So yeah, that's the good thing. Rather we look for the jobs, like government should create jobs for us, or we keep on serving our entire life in some hospital or clinic. So it's not a bad idea, like you create not only job or business for yourself but for others as well. So only thing is You should work hard wherever you are or in whatever profession you are. If you have
Yes,
passion,
exactly.
definitely you will touch the sky. That's it.
Yes. Okay, so thank you very much for honoring me. And I have dropped my number. Any one of you, if have any question, even later on, I will be very happy to answer. And like, please help others because you know uh, our life has become so self-centered and so selfish that we don't only think about ourselves. Okay, and if we think about ourselves, uh, like there will be no difference between us and animals. So if you want to be a human being, human beings are sensitive, human beings think about others, so we should also think about people around us. Okay, so thank you very much. And this I will share the recording of this, so you can share it to anyone you want. So even before I had some counseling sessions, so I will share the recording to anyone who is interested. Okay. So thank you very much. Bye bye.
Thank you, Dafis.